hip replacement is the operation that would benefit a patient who has got arthritis in their hip, whose symptoms affect his quality of life, his or her quality of life significantly. A hip replacement is the operation that will help with pain management in the long term as a primary outcome. And then as the pain is managed, patients can be more mobile and return back to their activity. A patient who will do well with hip replacement surgery is a patient who understands the extent of their symptoms and their effect onto their quality of life, and also understands what the benefits of hip replacement surgery are with its limitations, and is prepared to undergo that surgery. It's a very successful procedure that returns people back to function very well, and the satisfaction rates are quite high. There are some prerequisites for patients to there is various ways of how to approach a hip in order to perform a hip replacement, and I think it's quite important. It's a quite important parameter to distinguish between a patient doing very well to a patient having standard outcome from a hip replacement surgery. I have spent a long time trying to perfect how to go about performing a hip replacement, and I'm quite passionate about how my technique has evolved over the past few years. I have moved from doing a conventional approach to something more minimally invasive, and when I mention minimally invasive, I prefer to talk about minimally invasive damage to tissues, because that's what I do. I use a technique called direct superior approach, which not only is a minimal approach in terms of the length of the scar, but it causes almost no damage to muscles, tendons, and tissues that are important to help us walk and function normally. And therefore, patients that undergo hip replacement through the approach that I've described spend far less time in hospital, have far less pain following their surgery, and return back to a really good function very quickly in their postoperative period. And that is something that I regularly get fed back both from patients as well as physiotherapists and nurses on the ward. Okay, first of all, I would like to assure you that hip replacement surgery is one of the most successful operations that the medical profession has to offer. And it's successful because A, it provides a good result and patients are very satisfied with it, and B, the complications are very rare in this type of procedure. The main complications that people need to be aware of, and we can elaborate on when I definitely elaborate when I speak to patients and I give them a lot of information about it, is a risk of infection, which is again rare but important to be aware of, risk of nerve or blood vessel damage, dislocation, which is very rare with new implants and new techniques, the difference in limb length, again very rare with the techniques that we use these days, and fracture to the bone of the hip that we operate on. There is also risks that are generic to every operation that we perform on the lower leg, like DVT or PE, but we have various ways to reduce all those risks. So they'll expect to stay in hospital for 1 or 2 days. They'll expect to be able to mobilize on the same day from their surgery. They should be able to be reasonably independent within the next few weeks, and certainly within 6 weeks from surgery. In my surgical post-surgical rehabilitation regime, I do not recommend any precautions for hip replacement. So people should be free to use their hip as fast as they would like to, and within reason. But I would expect patients to go back to function within the first 6 weeks, and certainly go back to driving as well, which is one of the questions I get asked very frequently. As I said before, if a patient or if an individual is symptomatic, so if they've got a problem with their hip related to wear and tear, which means arthritis essentially, that affects their quality of life, hip replacement is a very predictable way to relieve their pain and return them back to the function that they have lost from their problem.